Hi, everyone. Welcome back to the Women's Health Conversations Best of Life Summit. We have had some really amazing sessions so far where we started out talking about the best of relationships, sex, and the technology that makes it all better. And you will not want to miss that. So go back and listen. This morning, we talked about the best of the 6 pillars of health with amazing experts talking about mobility, smart nutrition, detoxifying our environments, sleep and restoration, and financial fitness. Right now, we're going to dive a little deeper into a new concept that Women's Health Conversations is embracing. You know, we founded Women's Health Conversations in 2012 with the knowledge that women make 80% of all the healthcare decisions in this country, not only for ourselves, but for everyone we touch. And that by changing the health of one woman, we would ultimately change the health of her household, her community. And one woman at a time, we could change the health of this country, our economy, and our culture. And it has been an amazing ride. And this year is no exception, right? We've had this, I don't even know how to describe the year we've had, but we've emerged on the other side having had time to reflect. And one of the things we've reflected on at Women's Health Conversations is how we deepen our community. You know, we have thousands of women in live conferences, millions of women across the internet. But in this time that we've lived through, sometimes we find ourselves lonely in a crowd. So we have now created Ageless, which is a private membership community for 40 to 60 plus year old women who are in passionate pursuit of the best in life. Because sometimes we reach this middle portion of our lives saying, WTF, what's the future? You know, here is the fact. We don't have to wonder what the future is. You have always been a powerful influencer at home, at work, in your community. And as we move through our 20s, 30s, and even our 40s, we're ticking off these milestone birthdays, 20, 30, 40, each that is so emotionally packed. We get to this middle portion and we wonder, WTF? What's it going to be around? What is it going to be like to live in this era? And sometimes we look around and the media tells us that we've suddenly become irrelevant, that we're invisible. We can't even find pictures of ourselves or women who look like ourselves in the media. But the fact of the matter is, we are not dismissed. The fact is, we can create our future. We are the future. You are part of the most influential generation of our time. You are not done yet. You are ageless, you are authentic, and you're indefinable. Because here's the truth. There is a myth in this country that aging is an inevitable decline from the vitality of youth down some slippery slope to frailty, and that there's nothing we can do about it. But nothing could be further from the truth. And in this segment today, we're going to talk about what it means to live ageless. And so my first guest today is a new friend of mine. You know, I met her when she asked me to appear on her podcast, A Certain Age, and I was thrilled to go there and find a kindred spirit, a woman who is not done yet, who has already had success in her career and continues to do so, who has already raised an amazing family and is not done yet. So if Katie Fogarty would come up with me now, how are you?
I'm great. I'm so delighted to be with you. What a fabulous and warm welcome. Thank you.
You know what? On your podcast, A Certain Age, you have had the ability to interview so many fascinating women. I mean, I'm just thrilled that you've included me in this community of women who are not done yet. And I wanted you to help me today reframe these best years because we are not invisible.
Absolutely not. I agree.
We would be we would be taught that we are by sometimes not even appearing in media. What are some of the themes or thoughts that all this cadre of women you've brought together are bringing to the forefront?
Great question. I launched this podcast about 6 months ago, and I've recorded 35 shows. It airs every Monday. So I've spoken to a wide range of guests, including you. We had such a great session on active aging, and you got me so excited. I want everyone to listen to her episode. I have been brushing my teeth standing on one leg ever since, because I learned this incredible life hack that can help you with your mobility and your balance, and I've incorporated it into my life. So that is something that I always think of you when I brush my teeth. But what I've learned from my guests, from these 30 plus women who join me every Monday, I would say that I've learned three things. One, that pop culture gets midlife wrong, and Vonda, you alluded to this in your opener. There are terrible message about what it means to be midlife in this country. People think of it as equated to a midlife crisis, or you're getting old and you're dated and you're irrelevant. And nothing could be further than the truth. The women that come on my show see midlife as an accelerant, not an obstacle, right? They are in action. They have some wisdom on their side, and they recognize that they still have 10, 20, 30 years left, but time is becoming more finite. So they're really in motion about realizing their dreams, realizing their goals. I've had a first-time author who published her first novel at the age of 56. Mm-hmm. I have a woman who was a stay-at-home mom for 13 years and then launched this company at the age of 47, which she grew into this multi-million-dollar company. People pop culture gets midlife wrong. We are blooming during this phase. It's more midlife bloom than midlife crisis. I think the second thing that I learned from my guests is that it's really critical to share your story, which is why I was so thrilled to be part of this Best of Life Summit, right? People need to share what they're going through with people in their community, because sharing your story, it does two things. One, it takes some of the power away. I've had people come on my show to talk about, struggling with mental illness, to talk about, incredible sadness after losing a spouse or losing a parent when they die. And by sharing their story, it lessens some of the power of the story over them. And the second thing it does is it creates community. Mm-hmm. When you tell people what you're going through, you find this sort of warm hug that you can get from people that you share this with. A woman by the name of Terry Cheney came on to talk about her bipolar disorder. She published a memoir, and she said that the day before it was to be released, she was so nervous. But then she had such an incredible response to it that it lessened the power of this mental illness as a sort of a shameful thing over her, and it allowed her to be free. So I think that women on your Best of Life Summit who are talking about the challenges around health and wellness and mobility, you're doing such an amazing service by letting women know, the resources that are out there and what they can expect and how they can thrive during this. And then I'll finally say my last thing that I learned, the third thing, I've learned that resilience is a muscle, right? We don't get to midlife without encountering turbulence. We go through some things. We go through maybe job loss, divorce, death, dislocations, but we have gotten to midlife. We've survived them. Maybe it was hard and challenging at times, but we've come through them. And that kind of knowledge that resilience is a muscle allows you to be able to do new things and to, be willing to be uncomfortable, to try to publish a book, to try to launch a podcast, as I did at the age of 50. I was almost 51. I was 35 days shy of my birthday. And I said, why not? Why not me? And so because I've been through some things, because I've gotten to the age of 50, knowing that I have the ability to try new things and to take on challenges and to get through them, it really positions you and frees you. And that is that creative accelerant that I was talking about.
Mm-hmm. Wow, that is packed.
It's a lot. I've heard a lot.
These women that you've had on if those are the three themes, there's so much to learn from women like you and me. And a couple things you said I want to circle back to. One was, and maybe I read this, you said it somewhere, but I was wondering why 50 bugged me so much. Like, okay, at 40, I had my first child that I bore myself. We have a blended family of 6 children, but I bore my first child at 40. And so just at 40, when we're adulting for the first time, right? And we're getting our first annual physicals, I'm having a new baby. So 40 felt pretty young to me.
Yes.
But then something about approaching 50, and I'm 54 now, it bugged the living daylights out of me. And something you just said is the reason why. Because I realized that no matter how long I lived, unless I'm extraordinarily long lived, I am finite. I had never felt finite before. And 50 brought it into focus. And for me, I felt, oh my God, I don't have enough time left.
Right.
Despite everything I've accomplished or haven't accomplished, somehow it felt finite. But it is a second blooming. And I'm Chinese, as the Chinese like to say, I like the way they say it better than the way English Americans like me say it is, the other part of my culture. It's not a crisis, it's a second spring.
Oh, I love that.
Isn't that, that is
beautiful. I'm taking that on. I love that.
Please. And that's all I know about it. So I should dig deeper and see where, the origin of that philosophy is. But it's really not the fall of life, right? Some would say this is your fall of your life. This is a second spring. And so how would you suggest, talking to so many women, and I know you share this philosophy, how would you suggest we harness that thought in ourselves? Because we can reach this point not looking like we did, not feeling exactly like we did, because following you, we're going to be talking about beauty and perimenopause. And so real changes happen. We cannot just be Pollyanna, like it's all going to be the same. And I don't actually want it to be the same. Right. I don't actually want to be 20 again. You and I talked about in the podcast, that was fun, but I don't know. So
we don't want to go backwards.
How do you help women, or how would you help women come to terms with the second spring?
That's such a great question. I think that women, when you hit midlife, you do recognize that we just said our time is a little bit more limited and you really need to focus. And I think that the pandemic actually really helped us do that. The pandemic helped us prioritize the things that we care about, right? When everything else was stripped away, when your calendar, blew up and nothing was happening, you cared about certain things. You cared about whatever it is in your life, maybe your family, maybe your parents, maybe about making a difference in your community. Maybe you sought solace in a creative pursuit. I think that if somebody's looking and asking themselves, how am I going to make this next chapter amazing? I would ask you to cast your mind back to what you cared about most during the scariest time of the pandemic. And that's where you can really focus your energy on. And you can either maybe look backwards and say, what did I love to do when I was younger, when I would have done it if nobody paid me money to do? So that could be something that you could surface again to focus your attention and energy on. Or you could look ahead and say, what is something I've always wanted to do that I've never gotten to do? And for me, it was the podcast. I had always had in the back of my mind that I wanted to have this conversation with women and I wanted to launch a show, and I went for it. I said, this is something that I'm not going to, I will be unhappy if I don't do this. I don't want to be a year from today looking backwards and thinking, why didn't I do that? So I set myself in motion. But those are the two things that I would say. Ask yourself, what did you love to do in the past, or what you will be regretful if you never get to, and focus your energy on those two things.
Oh, that's great. That's very empowering, because there aren't the barriers of youth. We have more confidence in ourselves. We've lived through a few things. Resilience is a muscle, right?
Yes.
As you just said. So as we reframe this, and I didn't tell you we were going to do this, so reflect for me on these 3 words I've chosen for the mini community and women's health conversations: ageless, authentic, and definable. What would they mean to you or the women that you've interviewed in a certain podcast?
I think I love the word ageless, first of all, because I think that one of my guests had another word that she used on the show. It's called perennial. And the notion of perennial is not attached to an age or to a demographic. It's not that you're Gen X or millennial or you're a boomer, but that your spirit is, you're a perennial, you're ever blooming. And I feel like agelessness and that notion, they're linked together, that you can always be growing or blooming in terms of your mindset and your energy, no matter what your physical age is. So that I love Ageless because it's to be perennial in bloom, I think. Authentic is really just, it's a word that it's so important to use. It's just, who is your core essential self? And I think we get to midlife and we know that. Yes. And so it's allowing yourself to be what you want to be doing, to feel fully confident in expressing yourself and sort of confident in your needs. And it's sort of, one of my friends said this to me recently. It's knowing what you do well and knowing what gives you pleasure and knowing what the world needs. So if you can meet those three criteria, which I think getting to midlife helps you, it helps you understand, like, I know what I'm good at, I know what I want to be doing, and I really have a sense of how I can make an impact on the world. And then what was the third one? Indefinable.
Well, you know why I chose it. I'll tell you why I chose it. At my age, I've become a titch, not in a negative way, but a titch militant. Do not tell me how I am supposed to be at any certain place in life, because I've lived through a lot of things. I've experienced a lot of things. I have proven to myself and others that there are very few barriers, right? So I don't want to be defined as, or, Paulina, the famous model, she posted the other day that she is tired of the word still beautiful, still vibrant, still, well, what do you think I'm going to be? Just because I've accumulated enough candles to burn down my kitchen. So, that's indefinable. Don't tell me who to be. I'll tell you.
Yes, I love that. Thank you for sharing your thinking behind that, because I agree. I mean, I definitely bristle about being put in a box. And I've even done that. I've had conversations with women on my show. I'm thinking of the guest who's coming this coming Monday, who wrote a wonderful memoir called Available. It's a memoir of a year of dating and sex after a marriage ends. And she was saying that she has rediscovered her and reclaimed her sexual identity, which has been sort of sublimated by 27 years of marriage and, having 3 kids. And she was saying, it's so important to me now, it's so core and so essential that I don't, even my children's needs can't sort of trump my own core essence. What I need to be for myself as a fully realized person. And I think that's real. She it's not just with your sex life. I think women, and particularly if you've been a woman who's become a mother, you really do sometimes sublimate yourself to other people's needs. And it could be a family, you could be sublimating yourself to a job, you could be sublimating yourself to a set of like cultural conventions about how people think you should be. Yes. And I think, I definitely have gotten to that age where I'm like, I don't even want my husband, who I absolutely adore, he's my best friend and we've been together for, decades, but you don't get to call the shots. Like, I feel very confident for the first time, and I want to say first time in my life, but I'm able to articulate it maybe, that I don't know how, maybe not, I don't know how to articulate it, but like, don't put me in a box, don't try to label me, let me be who I am. And I don't know. Does that make sense?
It does. And it's a very strong position to be in. And I think it takes time to get to this place, fully ageless, fully authentic, and completely indefinable. So Katie, thank you for coming today to help me frame this argument.
This was such a treat. I so enjoyed it. And I'm 100% behind what you're doing. We need to be having these conversations, connecting with each other. And I loved being a part of this, Vonda. Thank you.
It's my pleasure. And please, everyone listening live and virtually all summer long, go check out A Certain Age podcast. It's delightful.
Thank you.
You're welcome. So thank you so much. And we are going to go right down the pathway now to explore these ideas of what it means to be ageless. And so right now, I brought together a really important panel to discuss ageless beauty, because when we think of this middle age, in men who are reaching middle-aged, they're called distinguished, right? They're talking about job performance and vitality. Well, when women get to be a certain age, sometimes we're put in a box of only being defined by negative things or the way our skin is changing. And so I know these 3 people very well, coming up to discuss some technology for ageless beauty, some philosophy of ageless beauty, but really, and also some practical tips, because I have taken advantage of the technology available to us now. So I'd like to bring up right now in a panel, Dr. Kimberly Singh, who is a board certified plastic surgeon here in Atlanta and who has become a dear friend of mine. Ella Antimarino, who is a registered nurse and the COO of Bellissimo Plastic Surgery in Pittsburgh and has been with Women's Health Conversations since its inception, and Crystal Romano, who's the VP of Emerging Technologies at Cartesa Aesthetics. So ladies, thank you for joining me today on the Best of Life Summit.
Thank you for having us,
Vonda.
Absolutely.
You know what? I first started thinking, actually started dismissing ageless beauty, if I'm honest with you, about 10 or 12 years ago when I was speaking at the Massachusetts Conference for Women. And I was on a panel with a woman who used to be a model, a dancer, then became a model, and now is a clinical psychologist. She wrote a book and was discussing it called Face It. Her name is Vivian Diller. And in that book, she talked about from being a beautiful woman, having been a performer, and now being a therapist, talking to the women about the way they feel about aging and the very visible way that women age and what society says about us. And so I was in my 40s then, and I kind of dismissed it. I mean, I've shared with you, Dr. Singh, in my 40s, my skincare regimen consisted of alcohol wipes in the hospital because that's all I had access to. It's not the best regimen, people. But I dismissed it. But now that I'm 50 and finite, I'm 54 and finite and thinking about ageless beauty, it's so much more than everything I thought when I dismissed it. When women come to you, they come to you for procedures, products, and advice, but what do they verbalize to you?
Am I going first?
Yes, please. And then I know Ella has a lot of ideas about this too, but
Well,
yeah, please, since I come and lay on your table, I'm happy to tell you what I think about this time of life. But what do women verbalize to you?
Well, first of all, thank you so much for having me. This is such an honor to be with such a cool panel today, and your seminar at large today. But, I think for the most part, women are coming in and they're curious. I think women, I don't see the women who are coming in and saying, make me look like I'm 20, right? When I'm 40, 50, 60. I think people are, for the most part, feeling very healthy. I think we're a culture and a community now where we're taking good care of ourselves, or at least trying to. And I think people in general just want to feel, well, rather just want to look as good as they feel on the inside. And sometimes, life and antioxidants and, free radicals get the best of us. So I think for the most part, it's really just restoring kind of a balance between how women feel and how they look on the outside. And it's really about their own personal goals. So I always tell my patients, there is zero judgment in this room. There is no right or wrong. Whatever your right is, if it's reasonable, we're going to try to help you attain that. And we're going to try to do it in a safe space where you feel very supported, not judged, and you can be whoever you want to be.
I think that's so comforting because media will tell us that a certain day flicks off our calendar and we're no longer relevant, or maybe we look different enough. I've said to Heather in your office, I just want to look 40 again. There's nothing wrong with what it's like to be this age, but Ella, when people come to your office, and Bellissimo Plastic Surgery is all about helping a woman be her own self, right? Not defining it for them. But what are women verbalizing to you and your staff? Because honestly, I really am okay with the way I am now, but we wouldn't be there if we didn't desire something.
I think they're coming in and they want to feel refreshed. They're looking for we're active longer. We're engaging more as we're getting older. Besides the pandemic, but we're out doing things. And really, you talked earlier about finding yourself, and as you're getting older, you're experiencing different things, going back to school, starting a new career. And I think they really want to refresh, feel vibrant. And typically, I think the 40s, they kind of come in looking at their skin and their texture, their tone, and they're curious. Like Dr. Singh said, they want to see what's available. You can Google so many different and get so many different answers for things that you can do. I think coming in and actually talking to the surgeon, talking to the nurse injectors or injectors, the estheticians, and really putting together some type of treatment plan to reach the goal you are verbalizing to the staff. I think, like for our practice, we have an opportunity to communicate online before you even come into the office. So it kind of gives you the opportunity to ask some questions, get a price range. I think defining beauty is so individualized. It's not a one size fits all. You can't say, fix me, I want to look younger. It's what's bothering you. What are you concerned about? And then really honing in on that.
Something I appreciate about both of your practices, Panacea Plastic Surgery and Bellissimo Plastic Surgery in Pittsburgh, is that you don't, Dr. Singh, you didn't tell me what to do. You listened. You said, what are your goals? You're letting women, without shame or pressure, be authentically them, because everyone's skin plan or appearance plan has to be individualized based on what they believe about themselves, right? But Crystal, is that something you see across the industry? You have the opportunity to work with a variety of plastic surgeons and present a variety of techniques to them. I'm wondering, is what we see here in these two people I've chosen because I know them and know their philosophy, or what is I guess what I'm asking is, what is the industry philosophy on women aging today as opposed to maybe what it was 10, 15, 20 years ago?
Absolutely. So it's changed quite a bit from 20 years ago. I now is less downtime, more minimal. So it's more about minimal, being more comfortable in your own skin, lessening that downtime, as well as some of these new technologies as well aren't necessarily a series anymore. So some of them may just be a one treatment protocol, like the new plasma devices that are out on upper and lower lid. So there's a lot of different things that we can do, but it has done a shift from having like a fully ablative CO2 and some downtime now to something where you can literally walk out the same day and not have to, hide in your house for a week to get some great results.
So I guess what you're saying is it's a lot more functional, maybe. Then, because that's certainly something that I've said, is that, like, I don't have 6 weeks to be down, right? Because we're all going. So, Dr. Singh, what is a skincare plan? What, when you're advising people, because I give people fitness plans, I give people nutrition plans. What's the steps and plans we should do?
Yeah, so I think it needs to be individualized, obviously, to each patient. And I think a good place to start is, what are you doing for your skin? Are you doing the most minimal things possible, which to me is, are you at least wearing sunscreen when you go outside, right? And we both live here in Atlanta, so we have a lot of sun here. What's your morning skincare regimen? What's your evening? Do you wash your face with soap, or are we, a little more advanced and are you using something from the drugstore? Are you using something from, Neiman Market? What's your plan right now? And then really analyzing patients' skin and saying, what are the deficiencies? Are you oily? Are you dry? Is texture an issue for you? Is pore size an issue? Or are we really just talking about sort of anti-aging things where, perhaps some injectables come into play? So it's really, I think a marriage of, first of all, like you said, just asking people what's important to you, because I can talk to you about every exciting laser that we have in our office, but you might just want a really good cleanser. And that might be where you are right now. So we try not to push people into, doing things that they're not ready to. But if someone comes into the office and they truly, let's say they're in their 40s, 50s, and they haven't really done much, I think starting with a good skincare regimen, which to me involves, at the very least, probably some kind of retinol or retin-A product, a very good vitamin C product. And if you really want to step it up, maybe something to help with, pigment. That's something here in Atlanta we see a lot in our patients who are just bothered by sunspots and dark lines and things like that. And then we can step it up from there. We can talk about, okay, well, I'd love my brows to be a little lifted, or I'd like to have my cheeks be a little fuller, or I notice that my eyes and my cheeks sort of don't communicate anymore, and I'd like to restore that. So we can talk about some filler and some Botox, and then we can also say, hey, what are some things that we can do in our spa, for example, that can, in my opinion, help you sort of organically fill your skin and do things on your own. We do a lot of collagen induction therapy type things in our practice, like microneedling with plasma, with, drawing your blood, is spinning it and using your plasma to help. I think that a lot of our patients are a little bit more on the organic side. So I think things like that tend to, be relatable. And it all goes back with, sort of knowing your patient and what they're comfortable with. I have a lot of patients who present and, the thought of Botox is like, I will never do Botox. Okay, that's fine. There's nothing wrong with that. Let's get you into some microneedling and talk about ways to sort of help you do it yourself. And then, of course, the last result, or the sort of taking everything that I've just set up a notch, is, talking about surgical options, which, to agree with Crystal, I think that's so rare these days, right? So maybe we do a lot of upper lid blepharoplasties, but facelifts and eye lifts and brow lifts are definitely things that I think on the whole are not happening quite as much as they certainly used to.
Well, that's the question I was going to ask you, is at what point do you pivot to I don't know anything about it, but I'm seeing a lot of deep plane facials going on in the internet, which is a terrible place to get your information, ladies, but I cruise around somewhat. So when is the right time? And there's probably not a definite time, but what are the questions you want your patient to ask themselves to know if it's the right time?
So I think it's really a matter of, where are you in your sort of satisfaction with what you've tried? What's your age? What are your goals? Right. So I know that, for example, all therapy, which is, I think, a great technology that we have in our office. I think it's wonderful. But, it's not going to replace a facelift. So I think it's also being very honest with patients and being authentic and not saying, yeah, this is just as good as a facelift or a neck lift. No, of course it's not. It's good, and it's going to get you some, good results. But if you come in with the expectation that you're going to look as though you had a facelift, then I'm failing you, if we're talking about that being synonymous.
So, you, Ella, you guys at Bellissimo have really taken on a patient education role in the community of Pittsburgh. And you put together a menopause makeover, like there's the mommy makeovers that are so common after women have stopped having children, but you've really put this all together as a menopause makeover. Talk to us about how you put that education together, because it's not just surgery. It's not just
no. We really delved into talking to gynecologists, nutritionists. I know you had Leslie Bonsi on earlier. Really trying to look at the whole package of what's happening through menopause and present that information to our patients. We get a lot of questions about things that women are seeing happening, and sometimes it's not something they necessarily are coming in to address, but they're seeing these changes. And so having a conversation about that, just to help educate them and give them direction of where to get more information. Something I wanted to say too, in regards to Dr. Singh, is that it's really, you can present all these devices and serums and procedures, but it's really too about where a woman's at. Is she happy? Is she fulfilled? You know, you can do so many different things, but if they're not finding their own personal satisfaction and happiness, then there's nothing really you can do to fix that internally. That's to help the external. So yeah, with our menopause platform, we really just kind of highlighted some of the procedures that women were talking about just to educate them. We have different excerpts from gynecologists about what's happening, what changes they would see. Dr. Antimarino wrote some parts on it, and Leslie wrote some things on it as well. So we really just tried to, again, educate patients on the whole menopause, what's happening during menopause.
That's right, addressing the whole woman, which is a really exciting way to approach it. But Crystal, you know, you spend so much time educating. What do you see as the future? What is coming up? What's exciting that we can look forward to in the plastics, aesthetics world? Because technology has changed so much.
Yes. And so this is what I spend the better part of my days doing, searching the globe for new things to bring to the United States and technology. I think one of the biggest things that has been the last year or two, maybe even 3, has been really popular are the plasma devices. And these devices are typically a one treatment protocol. Definitely want to go to a provider that's well trained and has an appropriate system, but they can really give you some nice results within one treatment. Most things are serious in our world in the aesthetics industry. So this is really nice where, more lid tightening to help with the crepiness, hooded eyes. Necks are beautiful, so tech neck, especially during COVID, I realized that mine was getting worse and worse from looking down on my phone and typing on my computer versus talking to people face to face. So that is something that has really been leading the way, are these plasma devices. And like time, one treatment protocol, but that has been something that has definitely caught our ear. The other things are non-invasive body contouring. And as we age, go through menopause, even after menopause, even post baby as well, we all have those stubborn areas that diet and exercise traditionally have a hard time addressing. So there may be that patient that isn't ready for that mommy makeover or tummy tuck or liposuction. And this is a non-invasive, no downtime way of, maybe feeling better in your clothing, addressing some of those stubborn areas. In the industry right now, what has been really popular and new in the non-invasive body contouring market is addressing fat and muscle. So it's nice when you address the fat and the muscle together simultaneously. It gives you a synergistic result. And I think, Dr. Singh brought it up, RF microneedling is a really nice, somebody's coming in and they're wanting to kind of start off experimenting with devices. RF microneedling is really nice to help build that collagen and elastin remodeling, help with laxity, some fine lines, texture, and some pigmentation. So that keeps getting better and better and better as the years go by, with different technologies added on to that RF microneedling. And last but not least, I know Dr. Singh had mentioned, same with Ella, so skincare. So skincare is the foundation to anything that we do. With these devices, the better we take care of our skin, the better results that we're going to have with anything. And so marrying procedures and any of these modalities with great skincare. So these aqua delivery systems that are facials that you may hear out there on the market, they introduce different serums into the skin by way of a vacuum, which is really neat and different. Those have been really on the rise in popularity as well.
Well, and I get the hydrofacial, which I like the serums being pumped into my skin and I come out feeling all dewy and this attention to detail at the cellular level with this 12 inches of skin, which has gotten a lot of attention lately in the press. I think it's just an outward manifestation, as you guys have said, of an inward self-care. And something Dr. Singh said, we had a mini summit prior to this one. And I asked Dr. Singh, what would you tell your 20-year-old self? And do you remember what you said? You said,
I do, yeah.
Yeah, say it again. Because we're all saying, what would we tell our younger selves?
So I believe I said, and I certainly would say it again, that, just self-love, right? Just
Love
accept
yourself.
yourself, and that radiates more than any Botox treatment or hydrofacial or plasma will ever do for you, honestly. And I think what Ella said is, point on. I couldn't agree more. Is, when someone comes in, trying to fix, gosh, I'm sure we've all seen it all, a marriage, job, you name it. We can't do that, but we can definitely help you sort of feel like we're part of your journey. And things that we do on the outside is just, gosh, it's such a tiny part of the whole journey for people. And I think that, I think in our industry, I think we're poised to have a unique perspective, because I think that you can go to, a plastic surgery practice or a dermatology practice, and you can walk away feeling pretty crappy about yourself when you leave, right? We can tell you, we can circle things on you, all the things that are wrong, quote unquote wrong. I hate that word. Or you can leave feeling empowered. And, I will say that, I'm not so in the clouds to think that, how we look does manifest it, I think, in everything we do. So assuming there is, sort of groundedness overall, if you feel great after that hydrofacial, right, it probably means you are going to take that little bit of extra confidence on an already very confident platform. And, you might radiate that to your daughter, right, or to your family, or to your job, or whatever you do. And so I do think that as sort of being in this aesthetic world, we do have a unique opportunity to, do good instead of propagating sort of these ideals of what we all, especially women, should look like. And I think staying relevant and keeping women feeling confident, I think that's the very best part of what I do.
You know what? I've chosen a very supportive, loving panel, and on purpose, right? There's enough naysayers in this world about, talking about women, but none of you have that philosophy. And Ella, you and I have actually lived in the same town and been girlfriends for years. But what is your best girlfriend advice just going forward, living through this stage together? You and I are about the same age. We've lived through this together. What would you say to the Women's Health Conversations girlfriends out there?
I think this is the opportunity to really look at yourself and how you want to define beauty. I think as we get older, we recognize culture and the definition of beauty in our culture changes. I think this is the opportunity to really focus on yourself and decide how you want to define yourself. And if that's something that you want to go to a plastic surgeon to maybe rejuvenate yourself or change something that's always bothered you to give you more confidence, I think then that's something you should pursue. But I really think this is such a key time for women as you get older to really recognize that you are defining yourself at this point. It's not about your children or your career, or it's really how you want to put yourself out there to the world.
I'm so encouraged by all of this. Crystal, are you encouraged by your industry? Are you seeing a real pivot to agelessness, authenticness, or indefinability?
Absolutely. I have to say, I've seen a much more holistic approach, and people just women looking to take care of themselves in whatever way that is. But I see a lot of multi-centered approaches going on, whether it be from, a mental health standpoint to a physical health standpoint, also just in, eating better, staying out of the sun. And so these things, years ago weren't really existing and factored into all of this and beauty in this aesthetics industry, and all the fun things that we have. But it's definitely a focus now and looking at the person as a whole.
Well, and that's what we've talked about this entire summit, on how to be in passionate pursuit of the best in life and to really be indefinable and living the way we are. So ladies, I'm so thrilled that you were with me today and took a half an hour to really talk about a philosophy of loving and caring for yourself in an individual way. Thank you so much for joining me today.
Thank you, Vonda.
Absolutely. Thank you.
Farewell. So you know what? It matters who your friends are. And that is a fantastic example of, as we were talking today about aging the way you want to, ageless, authentic, indefinable. And we were talking about how to access the best care. If you do not find a caregiver, a clinician, a counselor that shares your philosophy, I'm going to encourage you, maybe even give you permission to find people who have a like-minded philosophy, so that, you know, in the case of ageless beauty, someone's just not drawing purple circles around your face and saying, you are broken. You are not broken, as Dr. Kelly Casperson told us yesterday. So I'm thankful for that panel on ageless beauty. And we're going to continue our conversation about being ageless with a real pioneer in the premenopause, perimenopause, menopause, and postmenopause space, Anne Garnier. Now, Anne is the CEO of Lisa Health. And so if we could bring Anne up now, we're going to talk about taking charge of your own menopause. Anne, how are you today?
I'm great, Vonda. Thank you so much for having me on the program. I love that you are elevating this conversation and continue to be such a champion for women in midlife. It's my passion as well.
You know what, when people visit the website Lisa Health, which I sure hope they will, both live and in the future, this content will be available all summer, they're going to find a very thoughtful approach that is fact-based, not opinion-based. It's starting with an assessment to see where you are and then suggesting small changes. But here's the deal, Anne. I'm going to tell you, even a surgeon, you know, I had access to the best education in the world. I went to magnificent schools. And when this time of life came upon me, because, you know, it's my own fault, I dismissed what was going to happen because I was, you know, whatever age I was, I dismissed that this is a real transition. When menopause finally, you know, I had menopause, this point in time when I had my last period, it hit me like a brick. But I did not even realize the perimenopausal journey. Why was I not sleeping as well? Why did my periods change? And I think that your website goes a long way to help people understand. So is my experience common, or am I just the idiot who wasn't paying attention?
Oh, no. It is such a common experience because we don't talk about menopause. You know, we don't talk about it, you know, in mainstream society. And we also don't talk about it, you know, as part of the, you know, well woman, you know, care regime, right? So you go to your doctor and, you know, when you're in your teens, 20s, 30s, you know, you're getting regular conversations about period health, sexual health, pregnancy. And then it just is like crickets as, you know, you start to move beyond your reproductive years. I don't know how they think we women are gonna understand what's, you know, coming at us unless they start incorporating that into routine care for women. Because I think the number one thing that women tell me is, I wish somebody would have told me what to expect. They truly are blindsided, and nobody should be blindsided by a natural event that, you know, all women will have. Not all women will maybe enter menopause naturally, but the vast majority will. So why aren't we talking about it?
Do you think that and thankfully you and me and lots of people now are having this conversation, but do you think that one of the reasons that it hasn't been spoken of is because women's health has so traditionally been viewed as below the belly button? If it didn't have to do with OB-GYN, then it wasn't women's health, which is so not true. Women's health is top of head, the bottom of toes, and so is perimenopause and menopause. So how can we correct that? And tell me about the assessment that you guys do that helps identify what has to prepare us.
Sure. So, I mean, we do certainly need to reevaluate what we're teaching, you know, physicians, right? on average, they're getting like maybe 1 or 2 hours of training in medical school, right? And, the vast majority admit that they are completely unprepared, training or not, to discuss menopause with women. There are certifications through the North American Menopause Society, but only about 1,000 physicians have that more advanced training.
Mhm.
So, women are sort of left to figure things out on their own. And I was in that same position, and I'm a very knowledgeable and empowered healthcare consumer because I've worked in that industry my entire career, including on women's health concerns. And when I was blindsided like all the other women, I immediately went, to Dr. Google and Facebook, and that's sort of the second thing women do. And they say, oh my gosh, that was so confusing and complex, and I don't know what information to trust.
Mhm.
And I had the same experience. And so, having developed a lot of healthcare products, some for women, I just knew that you have to start with the basics. You have to start with, education, right? And I do see that is just a big desire for women around this life stage is, tell me what's happening with my body. Like, it feels out of control. I don't know what's happening. Is it menopause? Is it not menopause? So, the assessment that we have on our website is really designed to give women personalized insights into where they're at in their journey. We do strongly encourage women to go to their doctor, talk with their doctor about what's happening with their bodies. But like you said just a few minutes ago, if you're not getting what you need from that clinician, and many women are not, find another one. And I know it's hard because there are so few that are trained in menopausal care, but go to the North American Menopause Society website. They have a physician directory, and be persistent, because you should not have to suffer through years long cycles of trial and error, just trying to figure stuff out on your own. And that's what women by and large are doing. They're like, oh, well, my friend told me that, this supplement that she's taking from Whole Foods, like, really helped her with sleep, right? So they run down to Whole Foods and they grab that, $50, $60 bottle, right? And probably throw a few of the other things in their basket right at the same time, because you're in the supplement aisle. And if, I've got everything else that they're talking about. I've got joint pain, and, I have, hot flashes. And so I say, if you ever, doubt that there's a market for menopause, just go to the Whole Foods, stand in the supplement aisle, and just watch women, out of really just desperation, like, just buy all this stuff that, by and large, is probably not going to work for them. There's a lot of remedies out there that are being promoted that, have very little evidence that they work and may actually be harmful. So, we're trying to be that beacon of truth, that evidence-based, trusted, science-backed source for women. But we're also using advanced technology to deliver these personalized insights and, strategies that we know work for many women. It may not work for all women, but given, that many women want holistic alternatives to prescription-based therapies, or at least to try them initially, you need someone like Lisa Health who can sort of sort out the fact from the myth.
So that is so important. What is true? What is not true? And, this is called Women's Health Conversations, because women do sit across the table from each other and share information.
Of course.
But when I conceived Women's Health Conversations, it was a group of expert women sitting around the table so that we're not just getting opinions or old wives' tales. We're getting fact-based information. But let's put some timing on this. Earlier today, I had Suzanne Steinbaum, who's a cardiologist in New York. Come on.
Amazing.
Fabulous, yes. And I said, what age do we start this whole woman approach? And she said, have your last baby and then begin to prepare for middle. Now, if you have your last baby at 25, maybe that's a little early. But I think what she was saying is, when you pass out of the fertility portion of your life, it's time to prepare for this prime time. And on Lisa Health, you talk about pre-menopause, perimenopause, menopause, and post. So put a time, perspective? When do we
Mhm.
show up to begin thinking about this?
Mhm. Well, according to the studies, most women will start to experience symptoms of perimenopause in their early 40s,
Mhm.
although some women may experience them in their 30s. There are women who will experience early or premature menopause. There's about 6% of women who will reach menopause before age 45, either naturally or through sudden menopause because of cancer treatment or other issues.
Mhm.
So most women tend to start to notice some of the signs in their early to mid 40s, but they don't necessarily correlate it with perimenopause because,
That's it.
if they're having trouble sleeping, they just think, oh, I'm just stressed out. They just look at all these other causes because, again, the education wasn't there to say, here are some of the early warning signs. It really hits women, it really kind of hits home for women generally in their mid to late 40s when you're in the mid to later stages of perimenopause. So most women don't even realize that they've actually, according to the straw criteria, have broken just perimenopause down into early and late. And they even break down postmenopause into early and late. And so there's some very distinct signs. And so when you start having hot flashes, that's when they generally sort of say, okay, yep, you're in, mid to late perimenopause. And so you may actually reach menopause in the next, hard to put a number on it, but maybe 12 to 24 months. Really, your one of your other warning signs is menstrual cycle irregularity. So, you might have had a period like clockwork, like I did, and then all of a sudden, one month you skip it. I'll tell you what I did. I ran to the drugstore and got a pregnancy test. And I can't tell you how many women do that because you just think, and I know, of course, that it's so a lot of women also don't realize just because you're in your 40s, like, yes, ladies, if you're having a period, you can get pregnant.
Yeah, that's right.
So it was negative, and then that was like when the kind of like, oh, okay, there must be something else going on here, right? And so you reach menopause, which is really just a blink of an eye when you've gone 12 consecutive months without a period that's not related to some other cause. And then you're in postmenopause, and you're postmenopausal for the rest of your life. But I can't tell you how many women, they can't articulate that they're postmenopausal because, again, they've not had the foundational education or had a doctor that sort of says definitively to them, you are postmenopausal. They just say, I'm in menopause. But technically, you're in one of those premenopause, perimenopause, or postmenopause phases. And I think it's important to recognize your phase because there are certain symptoms, that are very distinct that occur for many women in those stages. Some may get worse. For example, vaginal dryness gets much worse in postmenopause, right? So if you have the awareness and the knowledge, right, it just empowers you, right? And you're not caught off guard. You're not sort of thrown off, your life's not thrown off balance. Knowledge is power. And when you have that knowledge, then you can start to think about, well, okay, now I'm going to take action on this, right?
Absolutely. Yeah. And when I had you on my podcast, Hot for Your Health, we talked about the talk because when you do the opposite end of the spectrum, this menopause and menarche are just, when do you start your period? When does it end? Right? The rest of it is all these phases. Well, what do we do if we're being conscientious leading up to menarche or puberty, if you will? We don't treat puberty as a disease, but we know that there are stages. We know that certain physical developments happen that predict the future, but we don't talk about any of that as a disease. And I would love for people like you and me to normalize the conversation around these phases as, yes, there are things that change, just like we get breast buds, we get dry vaginas, but it's not a disease. It's something to be educated about. It's something to be intervened if we want to. I mean, what can we do to change this conversation? I mean, I think what you suggested, education is critical. Let's just know what's going to happen so that I don't think, I was the opposite of you of I never had really 28-day periods. I was, I don't even know why. I was too athletic or too something. But then all of a sudden, I've got this regular schedule and they're heavy. Well, that's perimenopause. I didn't even know it. I was so proud of myself that I was finally old enough. But I known, right?
Right.
And I could have done something to prepare.
Right. Well, I mean, there is the sort of the mental, emotional preparation for a natural life stage. Yes. That's how we characterize it, as a natural life stage. Like, to your point, it's not a disease or a condition. It's as natural as starting your period. It's as natural as having a child.
Yes.
And it's a very powerful life stage. I think some of your guests talked about that earlier, and we echo all of that. The sentiment that was shared around women, please, like, embrace this period of your life. You have so much wisdom, so much experience, so much knowledge, so much life left. Celebrate that. And, anti-mame, the famous line, live, 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 right? Just go for it. And hopefully we're inspiring women to do that. But I think that by having conversations with women much earlier, I think even in your 30s maybe isn't early enough. It should just be part of the whole, here's the continuum, right, for women, and the different life stages you're going to go through. But really help women understand the power of preventive care, of lifestyle modifications, of starting those as early as possible. Like, I did a lot of work in pregnancy. And so, of course, had a lot of conversations with women about pregnancy and fertility. And, they would say, well, I'm thinking about having a baby. And it's like, okay, well, start practicing healthy lifestyle behaviors pre-conception, right? And so you have women who are engaging, like getting that education and engaging around it, because they're very invested in, the health of their child. But you should be equally invested in your midlife health, right? And invested in having a smooth menopause transition. By engaging in these lifestyle behaviors as early as possible, it can help you mitigate some of the more bothersome symptoms or help you to better cope with them. And it'll also just increase your longevity. It'll reduce your risk of all sorts of serious conditions. We women, we don't lack for things to be concerned about as we age, but a lot of those things are preventable. We've talked about this before, and I could go on, and I know I have a finite time, but and Dr. Steinbaum, I'm sure, mentioned cardiovascular disease, #1 killer of women. I say, ladies, I appreciate the fact that you're worried about breast cancer. Continue doing your monthly exams and, all the right thing there, but pay attention to your cardiovascular health, because you are more likely to die of that, right? Or at least not to live as well as you could, because you've got, cardiovascular disease. Brain health, bone health, lots of things, but a lot of it is so preventable. And that's, I think, part of the message around the menopause transition and embracing menopause is use this as a time of activation, right? And really understanding that if you for whatever reason really didn't pay a lot of attention to your health before, and I know it's hard for women because we take on far too much, in my opinion.
That's right.
But now is the time to invest in you, right? And to put your own health and well-being first.
That's a critical message, because we've talked about it all day. You cannot care for those who you care about unless you reinvest in yourself, because you can't overflow from an empty cup, if you will. But so I think a wonderful place to start for education, for understanding how to prepare for menopause while you're living in perimenopause and you're postmenopausal, is just, you've made it easy. Visit Lisa Health and all the resources that you've put together in a very evidence-based way. So I'm thankful, Anne, that you've come today to, just expose our community once again to the resources available for this critical time.
Thanks, Vonda. It was a pleasure to join you. And please visit us at lisahealth.com, and happy to answer any questions that your audience has.
Perfect. Thank you so much, Ann. I'll talk to you soon.
Thank you. Bye.
You know, it's tremendous that Lisa Health and other sites like hers are doing an evidence-based approach to premenopause, perimenopause, and postmenopause, because you'll get a lot of opinions. I always tell my patients when they come reporting things to me that you cannot get your information from the tabloids in the grocery store exit way, or from simply the opinion of people you know. You must go back to the evidence. And so I could not be more thrilled than I am to bring one of the authors of a book that has changed my life to the stage today. And she's going to present the data to you. You know, she and her co-author, Avram Blooming, have written this book called Estrogen Matters. And I'm going to bring up Dr. Carol Tavris today. How are you?
I'm fine, but I'm amused because today, after a year of Zooming, for some reason, I'm in a glare. So what can I do? I apologize for the glare.
You know, you look marvelous on the bright illuminated space you're in.
There you go. It's halo. My halo is shining again.
That's so great. You know what? When I first reached out to you, I shared the story about how menopause knocked me up the side of the head, and I went seeking answers. Mm-hmm. And if I'm really truthful, I didn't find many answers very easily, because I came from a cancer background, and I wanted to be sure of what I was going to do when it came to hormone replacement therapy and estrogen replacement therapy. And thank God that I came upon your book, Estrogen Matters. And I'm going to read the subtitle: Why Taking Hormones in Menopause Can Improve Women's Well-Being and Lengthen Their Lives Without Raising the Risk of Breast Cancer. And so I got a hold of this book, and first I listened to it all in one shot. It's like you reading for 8 hours. And I'm like, oh my God, I can take hormone replacement therapy, and there's so many reasons why I should. And then I had to buy the hard copy because I'm an underliner. Oh. So yes. So when I put together this Best of Life Summit, it would not have been complete unless I went to the source. So you can explain to us not only what HRT, ERT are, but really give us the true data. And you have put all the data together. These are copies of your slides. I'm so thankful. We're going to learn so much. So I think I have to get off the screen so you can go over, should we do this? What does the data say? And are we at risk?
Great. Well, Vonda, let me just say one thing. First of all, thank you so much for including me today. And I think it's important for your audience to know, you can tell that I am a person who is just a little bit past menopause myself. And I sailed through menopause without a symptom. It was never a big deal to me. And I remember as a young woman thinking, oh, big deal. So night sweats, so insomnia. So what, suck it up, ladies. You'll get through this. It's no big deal.
Yeah.
What I didn't know, I thought, well, estrogen declines at menopause, but I thought it declined the way testosterone declines in men. Namely, it just kind of tapers off. But in women, it truly plummets to less than 1% of what the circulating levels of estrogen are before menopause. So it's really a big change. And I want to say, too, I have no vested interest in this. I didn't take HRT when I was in menopause. I had no symptoms, neither did my mother. I didn't appreciate the issue. And as a young feminist, I shared the view of many women. It's a legitimate and important view that menopause is a natural phase in women's lives. It's not a medical disease. It's not a pathology, and women will differ in how they wish to deal with it. On the other hand, as Barbara Sherwin once said, she's a woman who has studied hormones and cognition. She said, what isn't natural is living 30 years past menopause. And the goal should be, how do we help women live those additional years past menopause in the healthiest way possible? So that said, when 20 years ago, the Women's Health Initiative, a $1 billion study by the National Institutes of Health, calls a press conference. Press conference, hormone replacement therapy increases the risk of breast cancer. No, causes breast cancer. Press release, press conference. Well, you can imagine this was worldwide panic on behalf of the millions of women who were taking hormones. So I thought, well, really? It increases the risk of breast cancer? Well, that's a scary thing. So then I went to listen to my dear friend Avram Blooming, who is a medical oncologist, give a little talk about the risks associated with breast cancer. This is what Avram has been studying for many, many years. And his own beloved wife had breast cancer in her 40s. So he was very concerned about this. So I go to listen to Avram talk about the risks of breast cancer. So first slide, please, Megan. So here we have the Women's Health Initiative in 2004. Women taking estrogen only have a reduced risk of breast cancer. The way you read this relative risk chart is any number 1 or higher indicates a slight increased risk. If it's below 1, it's a reduced risk. But that's not enough. In science, we have to know, is that increased risk meaningful? Is it statistically significant, as we say in science, or is it trivial? So, all right, we see here estrogen, it reduces the risk. Next slide. Fish intake slightly increases the risk of breast cancer. Trivial. Fish, right? You all get to eat as much fish as you want. Next. Here we have the Women's Health Initiative in 2003. Note this was not statistically significant, but it was 1.24. Next. This was the finding that got the Stop the Presses headlines. A slightly increased risk, 1.26. This was the finding that caused women worldwide to stop taking hormone replacement therapy. That risk was not statistically significant, which would be a no-no in publishing any professional medical article, but JAMA for some reason didn't care, published it, and so we had this big scare. Next slide. Okay, anybody who's had one additional serving of French fries in childhood, you have a slightly increased risk. Next. How about eating a quarter of a grapefruit a day? That's even worse than taking HRT. Continue. Night shift work, 1.51. Okay, we're getting serious. Next. Being a Finnish flight attendant. Next. Placental weight. Oh, well, now we're really there. Yeah. Okay, next. Antibiotic use, taken only more than 1,000 days, and only if you use it for rosacea. Somehow the antibiotic knows what you're using it for before it determines that it increases your risk of breast cancer. Next. Left-handedness. Next. Being an Icelandic flight attendant. So now you can see that if you are an Icelandic flight attendant who's left-handed and has to work at night, you are really at great risk of getting breast cancer, aren't you? Next. Electric bedding. Okay, you want to be careful about this because you certainly don't want to use electric bedding too often. Now, here's the point I want to make. All of these findings found a home in the medical journals. All of them are trivial. None of them caused a press conference saying, quit being left-handed immediately or you're going to get breast cancer, right? And here's an example of a relationship, a causal relationship that is meaningful. Next. Tobacco and lung cancer. Please notice what the relative risk is for this one. That's a finding that's meaningful and important medically and personally. If you smoke, your risk of lung cancer soars. All of these other little findings are just, frankly, silly. Even if they were significant in some small statistical way, they tell us nothing. Okay? So I watch this table that Avram has presented, and I thought, this is amazing. Now, so when we did our book, we went through all of the evidence, the decades of evidence on what we know about hormones and their benefits and risks, because everything we do in life has a risk. Of course it does. Walking across the street has a risk. So when it comes to the question of taking hormone therapy, it's worth knowing what the benefits are as well as the risks. Okay. So first, let's look at the symptoms of menopause. I know some of your speakers have talked about this already. The fascinating thing to me is how many of these symptoms women and their doctors do not associate with menopause or the perimenopause. So chest pain and palpitations. Oprah Winfrey went to 5 cardiologists because of chest pain before she picked up a book and it said, you know what, that's a symptom of menopause. Joint pain sends women to rheumatologists and to get treatment for joint pain. Depression and mood swings send women to psychotherapy or to antidepressants. Yeah. Loss of sexual desire, we go to sex therapists. Painful sexual intercourse, well, we know that's psychological entirely, don't we? All of these symptoms are a result of the plummet in levels of estrogen in the body. Next. Also, you know, my impression before I was in menopause is that menopause lasts, I don't know, a year, maybe 2 years. How long does it last? No. The average duration of symptoms is nearly 7.5 years, which means for many women, it's up to 10 years, 11 years of these symptoms that are not trivial. 10 years of sleeplessness and loss of interest in sex and feeling depressed is not trivial. And those symptoms carry their own consequences for women's health and well-being, needless to say. Notice that estrogen lowers the frequency and severity of symptoms by 80 to 95%, and no other treatment comes close. Drink all the tea you want, ladies. It's not going to do what estrogen does. Next. So Anne had mentioned, and quite rightly, this is so important. A woman is 7 times more likely to die of heart disease than to die of breast cancer at every decade of her life after the age of 40. It's heart disease that is women's greatest killer. And in fact, so many women now survive breast cancer. That they are more likely to die of heart disease than of breast cancer when they survive. Next. And as you see, it's even greater than her risk of dying of breast cancer. Next. Estrogen reduces the risk of heart disease by 40 to 50%. One statistician at Yale, who was so demoralized by the Women's Health Initiative's findings on HRT, did a calculation of all the women who went off HRT 20 years ago as a result of the Women's Health Initiative against the rates of increases of death from heart disease in the ensuing decade. And I won't even say the number, but he calculates that thousands upon thousands of women died of heart disease who could have been saved. Next. Osteoporotic hip fracture. Well, we hear so often about, hip replacements, and it's no big deal, right? So what? Fine. We just take your calcium and run around the block 12 times. Well, no, because calcium, let's have the first, next slide. Okay. First of all, I think this is fascinating. As many women die each year after osteoporotic hip fracture as from breast cancer.
Yes.
Really? And that, I think, is a surprising factor to people. They think, okay, well, you have an increased risk of hip fracture, but, okay, we can prevent that with bisphosphonates and other interventions. But next. Basically, there's nothing else that does as well for women. Calcium increases the strength outside the bone, but not inside the bone where the tensile flexibility exists. That flexibility depends, that is flexibility meaning, can a bone bend or yield before it breaks? Calcium doesn't touch that. Next. And that is why long-term hormone replacement therapy is more effective in preventing femoral fractures than bisphosphonates, which have their own side effects and risks, and you can't take them indefinitely. Even the Women's Health Initiative has said the one thing that estrogen is best for, well, I'll tell you what else they say later, is in preventing osteoporotic hip fracture. Next. Look at that reduction in risk. So for women for whom hip fracture, their mothers might have suffered from it, or they know it, they are at risk of it, this is something seriously to consider. Next. The brain. I'm fond of my brain, what little there is left of it, and so I would really like to keep it going. I think if I'd known the findings about estrogen and brain function, I would have started estrogen. Next. A woman in her 60s is twice as likely to develop Alzheimer's disease as she is to develop breast cancer. And we know there is no successful treatment for Alzheimer's once a person has developed it. This devastating illness that causes so much harm, so much death. Next. There have been many studies of the benefits of estrogen on the brain. Studies, field studies of women in nursing homes where you can start them when they first enter and follow them over time. Studies in the laboratory, studies with mice as well as with human beings. And you get this amazing result that it reduces the risk of dementia by 24 to 65%. The Women's Health Initiative would have you think that HRT increases the risk of dementia. But the way they discovered that was by eliminating the women in their sample who had healthy cognitive functioning. We now take only the women with mild cognitive impairment and see how they do over time, and they get worse. That was how the Women's Health Initiative generated that scare of the increased risk of dementia, by eliminating the women who had healthy brain function. Next. Longevity. Next. Now, this is really interesting. Next slide. Because of hormone replacement therapy's benefits on osteoporotic hip fracture, on the heart, on the brain, on so many other diseases, by the way, it reduces the risk of colon cancer too. It should follow that women who have been taking HRT would live longer because they aren't dying of heart disease and hip fracture. And indeed, as long ago as 1997, in a JAMA article, the conclusion was it should increase life expectancy for at least 3 years. Next. This was repeated in 2006. This study, look at this study. We have data from the National Cancer Institute, and we look at the mortality rate for women who had invasive breast cancer. We look at their mortality rate, nearly 18% for non-users, but only 4.5% for women on HRT. Next. And finally, just a few years ago, Roger Lobo at Columbia, doing a review of all of the evidence of all of the benefits of HRT on serious illnesses that are killing women, found that women on HRT have a 20 to 40% reduction in overall mortality rates. Now, you know, this is quite huge. I guess one more slide here. Begun in menopause and continued indefinitely increases longevity by 3 to 4 years. When you think of how many things we learn about in the medical and health world that might increase longevity by 3 months, 6 months, maybe a year, nothing compares to a finding like this. It's amazing, isn't it? Next. Now, notice the continued indefinitely part. For women who are at risk of hip fracture or osteoporosis, it's indeed true that once begun HRT, they need to stay on it forever, or as soon as they go off, their bones will revert to what it would have been before they began HRT. So that's an example of the importance of the continued use. But many doctors have come up with what I call this interesting compromise, which is their patients come to them and they say, I really, really want to take hormones. Well, okay, but in that case, take the lowest dose for the shortest time, right? This is the compromise. It's like saying, okay, you can smoke, but only smoke a little and for a week. Otherwise, I don't want you to smoke. If you really think it's dangerous, if you really think it's going to increase your risk of breast cancer, you don't say, okay, take a little of it. Have a little asbestos, just not a lot. And don't take your asbestos for very long. No, if it's dangerous, don't do it. But if it's helpful, well, so see, I think this was a compromise because so many women basically were saying, I really am doing well on hormone replacement therapy. I want it. You're not taking it away from me. Okay, well, just take the lowest dose for the shortest time. So I thought you would be interested in seeing what the North American Menopause Society concluded in reviewing the evidence on this. There are no data to support the routine discontinuation of HRT in women over age 65. No data to support discontinuation. Isn't that amazing? 31 international societies have supported that statement. One of Avram's patients, a woman in her late 70s who ran a business, I think she was still running the business when she was 78. I mean, as sharp as a tack. And she went to a new doctor in Minnesota or somewhere, and he took a look at her. She was a breast cancer survivor, by the way. Mm-hmm. It's another issue we might want to discuss. Mm-hmm. She goes to this doctor, and he takes one look at her, and he says, What? You're a breast cancer survivor, and you're taking HRT? This is very dangerous for you. It could cause dementia.
Oh.
Could you please talk to me? I'm not suffering from dementia here. She said to him, actually, what she said was, don't you read the research? Aren't you keeping up? She's very feisty. Okay, next slide. Now here's a summary. The Women's Health Initiative comes out with this huge report in 2002 that scared the bejesus of everybody, right? Mm-hmm. Where are they now, you say? Have they had any press conferences announcing that maybe they've changed their minds on a few things? Well, no. But here's what they currently conclude. Here's how they have been reanalyzing their data over all these years. And here are their findings. First, estrogen alone reduces the risk of breast cancer by 23%. This is after 19 years of follow-up. For women on combined estrogen plus progesterone, the breast cancer rate was not affected. Could everybody tattoo that message to your leg? The breast cancer rate was not affected. Next, as they had, we're back up one, Megan, back up one. Okay. Originally, the Women's Health Initiative said estrogen is terrible in all ways. It even increases as deaths from all causes. All causes. Well, no, it doesn't. And it does not increase deaths from heart disease and cancer. As I have shown here, it increases longevity, most notably when begun within 10 years of the last menstrual period. This is from the Women's Health Initiative. Next. Some of their other little findings. It's the best preventative for osteoporotic hip fracture. It is safe and effective when applied vaginally for local symptoms. A sex therapist friend of mine called me up and he said he told the wife in this relationship, he said, if you're having vaginal atrophy, vaginal symptoms, painful intercourse, all of those are completely normal consequences of menopause. 100% of women will have these symptoms after menopause. He said, just take a little vaginal estrogen. Here's a nice prescription for you. So she and her husband go home. They open the package. They look at the warning labels. This could cause dementia and heart disease and terrible things, and your fingers will fall off. No, good sex is not worth dying from this vaginal insert. So they didn't use it. And it's true that those warnings are still on the pack. But no, the Women's Health Initiative assures us it's safe and effective when applied vaginally for local symptoms. And finally, pregnancy. See, one of the really important issues about this hormone issue if estrogen really were carcinogenic, if it were carcinogenic, then we should see an increase in breast cancer during pregnancy when estrogen rises tenfold.
Mm-hmm.
Yeah. But it doesn't.
Mm-mm.
There was a long period where when women were diagnosed with breast cancer while pregnant, they were advised to have an abortion to preserve their lives. This is not necessary, and we now know that this is not medically, certainly not psychologically warranted. On the contrary, women who get breast cancer while pregnant have a better prognosis stage for stage than women who aren't pregnant. So estrogen is not the carcinogen that had been thought. I don't have this in my slides, but I find this even more amazing. Women who've had the BRCA gene and who therefore have significantly had their breasts and ovaries removed can safely be given add back estrogen, because after all, when they have their ovaries removed, they go into menopause with all the menopausal symptoms. And quite amazingly, when they are given add back estrogen, wouldn't you think that's adding fuel to the fire? Here we are protecting you from getting breast cancer. But no, their symptoms are alleviated at no greater risk of breast cancer occurring. Okay, next. And this was funny. In 2003, there were headlines all over the country. Hormone replacement therapy did not have a clinically meaningful effect on health-related quality of life for women in menopause. So after women stopped laughing, what are you talking about? No relation on health-related quality of life. This was quite nuts. Now they state that hormone therapy is the most effective treatment for managing menopausal vasomotor symptoms. This is the Women's Health Initiative themselves, which affect 70% of women and can last a decade or more. That's the latest statement from the Women's Health Initiative. So I asked one of the investigators, well, aren't you going to have a press conference? Press releases. Shouldn't this be headlines in the New York Times? Isn't this important information for women? Oh, she said, our job is just to do the research, not to publicize it. Well, they managed to publicize it when the news was scary, not when the news is reassuring. So that is my last piece of evidence here. I think I've whizzed through some of the highlights. You can see it's a complex issue, but what a surprise this odyssey has been for me. I mean, constant surprises for me, I must tell you. I fully sympathize with the complexity of the question for women. It is difficult, and for many women, there's something unseemly about taking hormones, right? It's like, I'm yielding to, this is a bad thing. I'm supporting the pharmaceutical industries. I don't like this. I understand that. I was a critic of big pharma. I am still a critic of big pharma too, in many ways. But following the evidence, as my dear friend Avram has been doing right along, has really been an eye-opener. I think the most fundamental surprise is that our fundamental belief that estrogen causes cancer is time to retire.
That's why this book and the work that you and Avram did to Dr. I shouldn't call him Avram. I'm not trying to be disrespectful.
You will.
The work you did of putting together data, which for the general public is inaccessible. As an academic, I'm used to going and living in the stacks, even when the times when you had to pull the journals down and copy that kind of research. And then once you get collate all the studies to really be able to interpret them in the way that you do as scientists is inaccessible to the general public. So the fact that you took the time to write this book and what you just presented to me, to lay people, to, people who have no scientific background becomes so clear. And so, you know, you've written many books, but if you had never written any book besides this one, you know, it would be life's work. It's amazing. So I'm thankful to you. And I know I sound like a fangirl, but this is really life-changing work. And even today, you know, you reminded me about the hip fracture issue with, you know, I'm an orthopedic surgeon and I go around all the time talking about how we have to prevent hip fracture because 50% of us never return to pre-fall function and 30% of men die. But you bet that next time I'm treating hip fractures, we're going to be evaluating where the women are in life.
Yeah.
Are they of an age where they could begin HRT? If they're not, well, then we're just going to treat their fracture, but we're going to start talking to their daughters. You know, every woman who comes through, because bone health is somewhat familiar. But some of the questions,
and bone health seems trivial compared to, I don't know what, heart,
cancer, brain, heart.
It is not trivial. It is not trivial, as you
well, you know, on Maslow's hierarchy of needs, it kind of is, you know, heart trumps bone. I say that all the time. But in terms of quality of life and whether or not you're going to die after you fall from a standing position in your house, you're right, it's not trivial.
Yeah.
Could you comment, because I know you talk about it in the book, the timing of beginning HRT or ERT? And just to, in my simple way, HRT is estrogen and progesterone for people who have their uterus, and ERT is just estrogen for people who do not.
Estrogen alone would be given to women who have had hysterectomies.
That's right.
And I'm quite horrified, actually, at how many women have had hysterectomies and their doctors don't even mention to them, you can now safely just take estrogen, and notice the reduced risk of breast cancer for that group of women. The answer is, first of all, women should be monitoring their FSH levels, you know, throughout their 40s. And if you have sort of surprising symptoms that suddenly pop up out of nowhere at 41, 42, 43, you want to consider the possibility of perimenopause. And your doctor will advise you on when might be the best time to begin it. Obviously, you want to begin it, you know, when you're in proper menopause. HRT needs to be begun within 10 years. We talk about the therapeutic window, roughly 10 years from the time menopause begins. After that, I mean, I can't tell you how many people have written to Avram. And by the way, for anybody watching, if you have questions about this, about our book, estrogenmatters.com, go there, updates are there, findings are there, and you'll be able to reach Avram directly if you have any questions. He has had so many letters from women all over the world. I want to take it. I'm 67. Can I start now? You know, I know. The answer is that because the arteries begin to narrow during and after menopause, the continuation of estrogen keeps those arteries open and flowing. But once they've begun to close, or any arterial plaque might have begun to form, there is a small risk in the first year of starting HRT that a clot could form. That risk seems to be existent for the first year, and then afterwards it goes away. But you can see why. It's not candy. You don't just start taking it when you're 75 or something like that.
So our therapeutic window is 10 years to start. And then if you could share you and Avram's opinion about a direction of compounded versus pharmaceutical pill form.
Right. Can anybody throw an egg at me here on the screen?
No, you are safe. Yeah.
We talk about this in the book because many women want to take bioidenticals. Now, see, the whole bioidentical movement began when the Women's Health Initiative said, don't take estrogen. And the reason is everybody understood that estrogen was really beneficial. So there was a market for some form of estrogen. How are we going to get it? Bioidenticals are, by and large, if they are FDA approved, just as safe and effective as Premarin or any of the other preparations are. Avram typically advises women. His favorite preparation for estrogen is Premarin because it contains several kinds of estrogen. one kind being the kind that's been shown to be effective in brain function. That's just one little side thing. But he has no objection to bioidenticals. He has a huge objection to compounded bioidenticals because for the most part, those are unregulated. They're not FDA approved. Anybody can compound any old thing, including fly wings. It's just that you have no idea what's in the preparation. And I want to be careful here about this because I understand, we say this in the book, women are so hungry for someone to care about their experiences in menopause. Menopause is not taught in many medical schools.
True.
And many doctors are completely ignorant about menopause, let alone how a woman would feel. Oh, honey, it's all in your head, just suck it up. So the specialists who promise to just take care of you, I'm going to make you a special preparation. This is compounded here, butterflies and a little estrogen, whatever. Some of them may be absolutely legitimate. It's just that the buyer has no way of knowing. And that is why if women feel they really want to go with the bioidenticals, just go to the ones that are FDA approved. And by the way, the National Institutes of Science have recently done a report on bioidenticals. You can find that on our website, estrogenmatters.com. But you'll see there the difference between the bioidenticals that are legitimate and what the scientists have had to say about compounded.
That's perfect. This half hour has been so valuable. And I actually have Estrogen Matters bookmarked on my computer for easy reference. So I want to thank you for your wisdom, for the hard work, and for reading the book to me in Audible. But Dr. Tavris, thank you for this life's work. It's really life-changing, and it's a joy to talk to you. Thank you for joining us today.
Thank you so much, Vonda. It's been a pleasure.
All right. Farewell.
Bye.
So I'm actually not kidding, ladies, when I talk about Estrogen Matters being a life-changing book for me, because I am an evidence-based doctor. I'm a scientist, a muscle scientist, and I was really searching for someone who had collated the evidence, because I could not possibly have done all that research, pulling it together, analyzing the data. And even the medical people I ask about hormones, replacement, it's the truth. What Dr. Tavris says is the truth. We do not spend enough time in medical school on these 40 years of prime time. We are very body part oriented or disease oriented. And I view menopause care not as disease care, but as truly lifespan care. And so I am thankful for this book. So if you have any questions about whether you should or should not take hormone replacement therapy, the first place I would start is reading this book, because an educated patient is my best patient. Read this book or listen to this book as I did, and then take that with you as you seek your practitioner, to your physician, to explore bioidentical FDA approved hormones or hormones in a pill form. So that was just remarkable. That is the kind of evidence-based information that Women's Health Conversations and Ageless Life, our new membership-only community, is going to bring you. We are not going to bring you just opinions. We're going to bring you evidence-based, best in class. So if this is interesting to you, you got to stick with us. So actually right now, I am really thrilled to bring a co-conspirator to the floor with me. Deeptee Jain is an orthopedic surgeon. She is a true, I've used this word several times in this conference, but I'm a sports guy. I'm an arthroscopist. I do incision through tiny little portals. Dr. Jain is a spine surgeon. But what's interesting is that she is so technologically advanced. She also does spine surgery through little bitty incisions. So not only that, she is an educator and really interested in getting people out of pain, right? Part of aging well, part of being ageless, authentic, indefinable, is living our best of life. And being out of pain is one of those ways. So she's going to come and talk to us right now about BLT. She's going to tell you what that means. And living without pain in an area that's almost epidemic in this country, which is back pain. So if we bring up Dr. Jain. Hello, how are you?
Hi, Vonda. Thanks for having me.
Absolutely. We're so excited to have you here. And were you listening to Dr. Tavris just
I
now?
was.
It's just fascinating data. And I love that. That's what we all should be doing, right? Is presenting that in an evidence-based way. And certainly in orthopedics, we do that. So I'm going to leave the floor to you as you present to our crowd how to live without pain.
Sure. Well, thank you again for inviting me here to speak today. I am a minimally invasive spine surgeon, and I have treated thousands of patients with low back pain. So in this talk, even though I am a surgeon and I love to operate, I'm actually going to focus on avoiding an operation because no one really wants spine surgery. So we are going to talk about BLT and the ageless spine and what that means. So I'm going to break it up into two parts. I'm going to show you how important your spine is, and how debilitating back problems can be. And then I'm going to tell you how to keep your spine healthy and ageless, and what to do if things aren't going so well. So I'm going to start by showing you two pictures. Let me see if I can figure this out here. Okay, did that come through? I'm not quite sure. Vonda, do you think you can see that?
Yes, we can see it.
Okay. It's not in presentation mode, however.
It's okay. It's a slumped over girl. Her posture is terrible.
So, what I want to show you in this one image is that you've probably made assumptions about this person's energy level, about this person's vitality, about this person's age. So just this picture conveys so much information. So I'm going to show you now another picture. And this picture maybe gives you different feelings and different ideas. Maybe you have different assumptions about this person's energy level. Maybe you think this person's healthier, or maybe this person's younger. So those are really the only two pictures that I wanted to share. And what's really the difference between those two images? It's very simple. It's posture. I mean, it's the same person in both images, but both convey very different feelings. In the first image, the person was completely hunched over, and the pelvis was what we call retroverted in order to keep the head over the pelvis. Whereas in the second image, the person was standing up straight and tall. So what does that convey to you? That these two people have very different personas. And every interaction that we have with someone, we are communicating with them through our posture. So as you can see from those two images, posture conveys so much about age. And we're talking here about the ageless spine. And when I think about my 87-year-old grandmother, I think about someone who's hunched over, someone walking pitched forward with a cane. Whereas when I think about my 23-year-old brother, I think of someone standing tall and proud with his chest out and playing sports. And in fact, I often joke that as a spine surgeon, life is one big kyphosing event. That is, as we age, we tend to bend more forward. The word kyphosis refers to when the spine bends forward. So ultimately, the foundation of good health and good spine health is good posture. If you were building a 100-story building, you could not do so without a strong foundation. Now, imagine a poor foundation in the body. What would happen to your body? You would topple over, just like a building. The spine has an economy of motion and a cone of economy in which it can stay upright. If you're outside of that cone of economy, life becomes very difficult. Movement becomes very difficult. Socializing becomes difficult. So I bet the audience might not even realize the power of your spine. Every nerve that controls your arms, your legs, your breathing, your sex drive, your ability to go to the bathroom courses through and around the bones of the spine. And spine problems, as many of us probably know, can be very disabling. We know that 80% of Americans will experience at least one episode of severely limiting back pain in their lives. We also know that a lot of these people will experience chronic back pain, According to the CDC, low back pain is the second leading cause of disability in this country. So ultimately, what I want to say is that physicality changes psychology, ultimately through the power of the spine. And I'm going to say that one more time because I think it's so important that physicality changes psychology. And what do I mean by that? I mean that I want to change minds through motion. On average, there are 33 bones that make up the spinal column, and each bone is associated with 6 joints, including the disc above and below each level, and also the small joints called facet joints in the back of the spine. So why do I bring that up? It's because it tells us that our spines were made to move and to stay in motion, always. And so there it is, the secret to the ageless spine. It's BLT. What we say is bending, lifting, twisting. And anyone who's had spine surgery has heard those words because we tend to limit those functions in the immediate post-op period. But in general, we want to maintain the BLT. We want to maintain spinal flexibility and power, stretching and strengthening. So ultimately, the best thing that anyone can do for their spine is to stay active. When strength training, focus on the core muscles, some of the largest and strongest muscles in the body. The erector spinae muscles in the back, the rectus abdominis muscles in the front. These muscles are dynamic stabilizers to the spine, and they hold the bones and joints up. And besides keeping the muscles strong, staying active and applying load to the joints and bones also keeps the joints and bones strong. Bones are living tissues. They respond to mechanical forces. So if bones see more physical stress, over time they will build up bone mineral density. Studies have shown that small additions to bone mineral density, 5 to 8%, can increase bone strength by 60% and increase bone fatigue life by 100-fold. Furthermore, keeping the bone strong can entail making sure that you're consuming the right nutrients. Women under 50 need 1,000 milligrams of calcium and 800 units of vitamin D per day. And for women over 50, those numbers go up to 1,200 milligrams of calcium and 1,000 units of vitamin D. So now, what do you do if you end up being one of those 80% of people who actually have an episode of back pain? Again, the key concepts: stay moving. Now, that may seem counterintuitive. A lot of people think, hey, I'm in pain. I should probably take a break and rest for a few days. Our bodies are trained to think that pain is alarming. Pain is like smoke. It tells us that there might be something wrong, but ultimately there's no fire underneath. In most situations, we should do the opposite. Keep moving. Stick with the BLT. According to clinical practice guidelines developed by the North American Spine Society, as well as other societies, episodes of back pain should be treated by avoiding bed rest and returning quickly to normal activities. So we've talked now about really staying active, but let's take it a step further. If you're having spine symptoms and you're overweight, lose weight. That may seem obvious, but research shows that even a small amount of weight loss, like 5%, for example, can lead to substantial improvements in back pain and if someone's experiencing leg pain. Now, everyone knows they should exercise more, lose weight, and eat healthy. But I would hazard a guess that most people struggle with those goals. But the time to make those changes is now, and here's why. You don't want to end up sitting in my office contemplating surgery before you start thinking about it. The threat of spine surgery is a real one, and it's a scary one. So I have a very wonderful 58-year-old guy who I just saw this week. He's having severe back pain radiating into his legs for the past year. He can't walk more than a quarter of a block. This guy is a successful businessman. He owns and runs 2 bars, and his pain is debilitating. He also happens to be very overweight and weighs over 300 pounds. So frankly, even though I think he might benefit from an operation, his weight makes me think twice about doing an operation because of the risk of surgical complications, infection, medical problems after having surgery like a heart attack or stroke. You don't want to be the patient sitting in the office chair and your surgeon tells you that you might be too overweight to complete a surgery safely. So this patient asked me, but doc, I'm miserable with pain. I can't move. I can't stay active. How can I lose weight? So even if pain is limiting function, we know that 80% of weight loss comes from diet modification alone. So when I asked this gentleman for a diet history, we discovered that he was eating candy regularly, eating pastas and sandwiches for meals, and other carb-heavy snacks. So we had identified the problem, and I'm sure many people listening in the audience have struggled similarly. So my few dietary recommendations are as follows, and this is what I tell my patients. Cut sugars out of drinks. It's incredible how much sugar we might consume and we don't even know we're consuming it. Sodas with sugar, juices with sugar, coffees, teas, all of these sweetened beverages. When I take a diet history with patients, I realize sometimes that they are consuming maybe up to 1,000 calories a day just from their drinks. And those are patients who lose weight very quickly when the sugar is cut out. So second, cut out pure carbs, pastas, breads, rice. A lot of patients say, oh, but I eat whole grain bread. My response is, those are still carbohydrates. Those are not providing a ton of nutrient value while still providing you with calories. So what I've talked about here so far is posture, motion of the spine, diet. And all of these tie into vitality and energy level. And it's a virtuous cycle. As one starts to move more, one starts to eat better and improve overall health. So there are a host of other things that we can do to treat low back pain, anti-inflammatory medication, various injections. And if all those fail, well, you'll probably end up in my office. But the whole point is to try to avoid those things and keep the ageless spine.
Thank you so much for sharing your wisdom about the spine and low back pain. I thought the pictures you showed were so graphic, you know, the way that the physicality is attached to the, did you say mentality?
Psychology or mentality.
Psychology, right? And that whole postural forward and then correcting the posture. You know, I'm a spine gal. I mean, I'm a sports gal. And when I walk into a room and all the teenagers are sitting like this, the first thing I do is I stick my hand in the back between their shoulder blades and I correct their posture. And I say, you know, I'm going to act like your parent now. And I'm correcting your posture because for me, it has to do with their shoulder pain. But then that progresses through life as we all sit like this over our computers all day, and then it becomes an epidemic of low back pain. And so I think the lifestyle approach you've taken is so important because, you know, frankly, I know you hate to hear it as a spine surgeon, but nobody wants to meet you in the OR.
Exactly. And that's what I tell all my patients. You know, I hope that you don't need me anymore. And sometimes I work with patients to lose weight, actually. I will say not very many spine surgeons will do that, but I do it. And they come to me a few months later and they say, hey, my symptoms are better. I don't think I need you anymore. And I think that as a spine doctor, I've done my job.
Well, and actually that's true. And that's so consistent with our approach in this summit to being about the whole woman. You know, if you focused on just the couple vertebrae that you know had a bulging disc, that is the body part approach versus going to someone like you or someone like me that approaches you as the whole person, the person that carries the weight through their spine. So, well, thank you so much for that. And where can people find you if they want to know more about what you do?
Oh, so I am on faculty at Washington University in St. Louis. So if any patient wants an appointment with me, they can definitely fly to St. Louis. But also I have a website, deepteejainmd.com, and it has a wealth of information on it. And anyone can learn more about low back pain and back pain treatments, actually. You know, we could give a whole nother talk on surgical management, but you know, I thought that might not be the best topic for today, but you can read all about it on my website and different kinds of surgical management, both minimally invasive techniques and open or classic surgical techniques.
Absolutely. Thank you so much, Dr. Jain. So, you know what? I love that approach to the whole woman that she's presented to you today. And pain can be both physically debilitating and psychologically debilitating. So, as part of being treated as a whole woman, it's important to seek out a clinician who will approach you that way and not just a body part. So the last speaker in this section about living ageless is, I all day have been calling this prime time, right? These 30 years when we have accomplished enough in life that we're feeling more comfortable with ourselves, And we're at a certain stage where the things we're addressing are so much different than when we were 20 and 30. But when we get here, I also said today that I feel more finite than ever, right? I realize that at my age, time does not extend into millennia. And that even though I'm working hard on my longevity and my health span, that time matters. So my next guest is Dr. Rupa Wong. Her day job, as I like to say about my day job, is as a physician. She is an ophthalmologist. She has her own private practice in Hawaii, where she's joining us today. But you know what? She's also an educator and an entrepreneur. And one of her specialties of education is time management. And she has a whole course series for physicians on how to squeeze more time out of the time we have. So I asked her to bring that today and share some wisdom with us about how to make the time we have the best time of our life and how to get more of it. So Dr. Wong, if you're with us, how are you?
I'm great. How are you?
Well, I'm honored and thankful that you win the prize for longest digital distance between us and Hawaii today. And I'm also thankful that you're approaching a topic that's so critical for living ageless is time matters. And we can squander time or we can have more of it. So I'm just going to sit back and learn from you right now because I've taken your quiz and learned what kind of time manager I am. So take it away. I can't wait to learn more from you.
Thank you. Okay, let me get started right here. Let's see. There we go. Oh, can you see that? Not yet. Let's try one more time. Oh, I think that it is not allowing the screen to share with the Google Chrome settings for some reason. So I can just go through, oh, it's requesting all of these things for it. But my main concern is about time and trying, like you said, to get more of it. And I really think if you want to, can you just, I'm going to actually ask you, Dr. Wright, if you don't mind, I'll go through the system settings real quick. I think it wants me to do something with Chrome and then I can get back to the slides. This is always the issue, right?
No worries. No worries. Actually, while you're working on the, have you got it or do you need more time? I'm going to talk about our community. Yeah, I'm just going to remind people that Women's Health Conversations is a very large digital platform that you've probably found us on. You know, we have live events. This is similar to our live events, except that, of course, it's digital this year. And this content is going to be available all summer. It's your summer reading list or your summer viewing list. But more importantly, and I keep mentioning it, we are forming a membership community called Ageless Life. And I have spelled it phonetically, AJLES, to remind us that we're ageless, authentic, and frankly, indefinable at this age. And the topics all weekend long have been surrounding how to live the best of life, how to passionately pursue the middle years. Because listen, birthdays fly by. And as they do, we reach these milestones that are emotionally charged. I mean, think about it. Birth, emotionally charged. Toddler, teenager, emotionally charged. 20-something, 30-something, until we finally reach 40, 50, the middle. And we get here sometimes having sacrificed our youth on the altar of success, and we wonder, will our health last? And so today we are reclaiming this prime time, these 30 years, 40, 50, 60 plus, and re-examining how we can live the best of life, because it's important. You know, we've heard today already, as Dr. Wong is getting technically back up, we've heard, I'm going to remind you what we've heard about in this summit so far. We started out, as we always do in women's health conversations, with Hot for Your Health. We had 5 amazing speakers, and if you did not join us then, I am going to encourage you to take advantage of the opportunity to view this content all summer long. We started with Dr. Juliana Hauser, who talked to us about the best of relationships and how we need to connect and be authentic, and talk to our partners. Number 2, we talked with Kelly Casperson, who is a delight and a dynamo and has this amazing podcast called You Are Not Broken. And if you have not gone to listen to her talk about the best of your body and relationships, you need to get there. And then we were joined by Jerry Ann DiPiano, who's the CEO of a company called Fem Pharma, to talk about new tech that's available to women in this prime time. Listen, in the tech world, women, or femtech, and specifically fem aging, are completely ignored. When you look at the money spent on both sides, completely ignored. So that was our first session, and it was marvelous. And you need to go re-listen to that many times if you can. The next session, which I hope that you heard today, but if not, that you'll go back and listen to, was about addressing the whole woman. All day today, we've been talking about not just being a body part, but being top of your head to bottom of your feet, one salient organism. So we can't just address our headache as a headache. How does it relate to our stress level, our heart, our entire body? The session we just finished was called The Best of Life, the 6 Pillars, where we talked about the 6 and probably 7 pillars of health, which are social interaction, detoxification. We talked about mobility, smart nutrition, finance, and sleep and restoration. And in this session, we've been talking about subjects of agelessness. And we are about to rejoin Dr. Rupa Wong, who is an ophthalmologist by training, but an expert in time management. Because as I said, as we took this technical break, we're living in prime time, but sometimes we don't have enough time, and there are things we can do about it. So Dr. Wong, if you're back, I can't wait to hear you.
I am back. Thank you for that. All right, let's dive in. So I think as women, especially women in this particular age of our lives, it's so important to reclaim our time. And I wanted to share 3 secrets to finding hidden time in your day, because I think it's just important to be able to have time for ourselves, to have non-time, time that is not scheduled, time that allows us to refill our cup. And I wanted to address some common misconceptions about time and how we can use them to find the hidden time in our day. So I just wanted everyone to think about this for a second. How much would you pay to have an extra hour a day? When we're young, we are used to working really hard, and not that we're not working hard now, but we seem to have a lot of time. And then as we get older, it flips, and we have not as much time, but more money. And I think it's really important to revisit that issue of how valuable that time is for us. Now, you might be listening to this talk. It might pique your interest because first reason, because you're overburdened. You might be overwhelmed and overcommitted, and you crave work-life balance so you can do the things you love with the people you love most. Or you just might want to be able to be more present for those in your life that you are there, but sometimes you're just running through that endless checklist of to-do tasks in the background of your mind, which is really preventing you from being present. Third, you just might want to crave freedom and openness in your schedule at this period in your life because you want to pursue the passion projects and self-care and the hobbies that really light you up. So if you think about this, and I don't know if the comments are enabled or not, but you can think about which one you are, 1, 2, or 3, or if you're all 3, I'm kind of all 3 right there. And whatever your motivation is for being interested in this topic, I support you because I think it's really important that we reduce the guilt associated with women taking time for themselves. And a little bit about me, Dr. Wright introduced me. I am a board certified ophthalmologist. I have a private practice with my husband, who's pictured there. We live in Honolulu, Hawaii. I have 3 children and a dog. And, we've got a busy, busy clinic, but I also have time for multiple projects that light me up. And I still have the time to build my eye clinic, to be one of the premier practices in the community. And I can do all of these things without feeling burnt out or overcommitted. And that's what I wanted to ask, if you can imagine what it would feel like to have time to truly do what you want to do in your day. And I think the most important thing that we can do is to create strategies that effectively use our time. It's just honestly the single most powerful way that we can reduce stress and burnout. So secret 1 is there is enough time. And I know you're probably thinking, how is she listing this as a secret? This is not a big secret, but bear with me and I'm going to get to it because there really is enough time because it's all the time that we have. So I want you to think about how you would complete this sentence. If I only had more time than blank, then I'd go on vacation. Then I would pursue this passion project. Then I would spend more time with my family. Then I would work out more. I want you to think about how you would complete that statement. And then I want you to recognize that statement for the limiting belief that it is, because it is what's holding you back from achieving your goals and pursuing your passion project. It's a false belief and it's a little bit of an excuse because really it comes down to making sure that you are doing the right things and not just more things. And it comes down to prioritization because once you truly accept that time is finite, you have to start prioritizing. You're going to start staying true to your personal mission statement. You need to say yes selectively. You have to eliminate distractions and you have to recognize that all work is not created equal. So a mission statement, we think about mission statements, your company mission statement, if you're an entrepreneur or you're a business owner, a lot of the companies we work for have mission statements. I have one for my practice, but I think it's equally as important to have a personal mission statement. And it's simply a statement that explains your personal goals, how and why you do what you do. It's your why. That great TED Talk by Simon Sinek, available on YouTube, that 8-minute TED Talk, just so good about start with why. And I think it's just as applicable personally as it is for a company. We all have 1,440 minutes a day, and it's what we do with them that counts. I always say Beyonce has the same amount of time in her day as we do, yet she is able to do everything she is. So we can too, but it's not about pushing ourselves to the brink of what we're physically and mentally capable. It's truly about learning what we should be doing and what we should not be doing. You can get the important things done each day. You just simply cannot get it all done. So whether it's prioritizing your family or your work or your charity work, the key is recognizing this statement. And that can be really hard for us because many of us as women, we are used to trying to do it all. And we simply add more and more and more. And that is not the answer. You need to say yes selectively because you have to remember that every yes you say to something is a no to something else. Now, I've given the example, I've been asked to speak a lot in the past, but since I live in Hawaii, I'm very selective about the opportunities that I speak at. And actually, the virtual conferences is much better for me because I know if I say yes to an opportunity, it means I am saying no to being able to have dinner with my family, which is one of my personal mission statements. We have dinner together as a family 5 to 6 nights a week. It was actually usually now 7 with the pandemic. We used to save one night a week for a date night with my husband and one night a week for any kind of business dinners. But that's very important to us as a family. So you have to think about your time is finite. So you have to learn to say yes selectively. And I love this quote by Warren Buffett. The difference between successful people and really successful people is that really successful people say no to almost everything. So I want you to consider the last time you said yes to something that you wish you hadn't, whether it was, helping out a friend with a presentation or anything. And I want you to consider the difference. What did you say no to be able to say yes to that? Did you feel a little bit uncomfortable to say no, and that's what forced you to say yes? Just consider those things. And then remember that all work is not created equal. Just because something is important doesn't make it just because something, is urgent doesn't make it important. This is probably one of my most favorite things I have ever learned in my 13 years of running my own business. We had a consultant come to evaluate our practice, and he introduced me to the Eisenhower matrix. And to me, this was game changing because we are often doing the urgent, and sometimes it's important, but oftentimes we're doing the urgent and not important. We're rushing from problem to problem, putting out fires. And the urgent problems take our time and our attention. It's how we exist. It's just the nature of what we do. And I think it's the nature of being a woman. But I believe the secret really is learning to distinguish the difference. So prioritizing effectively gives you more time by eliminating the things you shouldn't be doing and focusing your energy on those that you should. Secret 2 is that efficiency is not the answer. Likely when you entered this 20-minute talk on time, you thought, I just need to be more efficient with my time. That is not the answer. There's a difference between being efficient and effective, and you want to be effective. So what's the difference, you might ask? Efficiency is the process of achieving maximum productivity. And it's often with minimal amount of effort. It's about doing tasks quickly, whether or not they're important. But effectiveness, that's the ability to choose and do the most relevant tasks to make forward progress on your goal. It is purpose-driven. It connects back to your why, which is why I started with that personal mission statement. So efficiency is just doing things quickly, but effectiveness is doing the right things. You want to learn to avoid useless work that shouldn't be done in the first place. So be purpose-driven in the work that you do. Start with your goals. They should inform all of your actions. And effective people always know their why. What is your why? What are your core values? And I think if you take nothing more from this talk, I think this one will be it. We often have a laundry list of to-do items. I don't know, mine used to be 20, right? 20 or 30. And I would look at the end of the day and I would have accomplished 7 of them. And I would feel like a failure that I hadn't gotten everything done. And it was so discouraging to me. And that's when I started to pivot the way I think about my to-do list. To-do list should be short, only 1 to 3 items, 1 to 3 goals for your day. What if you could only get those 3 things done or 1 thing done would make you happy by the end of the day? But what's more important than your to-do list is your not to-do list. That's what's more important. What's on your not to-do list? That right there. That stuff that should be eliminated, the not urgent and the not important. I guarantee you've got a lot on your plate that's not important and not urgent. Secret 3, time is your most valuable asset, not money. We need to learn to invest our time, not just manage it. So it's really not about time management, it's about time investment. How do you invest your time? It's actually a skill set that can be developed. It's not that people are just born with this inherent ability that they're just good at, effectively using their time. It's a skill set. So step one is to develop an awareness. What's your main issue with time management? Is it procrastination? Is it shiny object syndrome? That's me. I tend to get distracted. Oh, there's a shiny object. There's a shiny object. Or is it overcommitment? You are just committing, saying yes to too many things. Step two is to design your schedule. I want you to set goals, create clear deadlines, and prioritize the important and not just the urgent. And then this is the most important. Step three, reevaluate. You need to be constantly reevaluating everything. Assess how long tasks take to complete and make the changes as necessary. What would you do if you had an extra hour a day? I have two little downloadable checklists here. If you want my little time management daily checklist or my say no checklist, both of them, you can grab them at those websites down below. I think that the saying no one is really game changing because there's a lot of times we say yes thoughtlessly. And if you are clear about your core values, your goals for the year, and whether or not a project lights you up, is it a hell yes? If it's not a hell yes, then it really should be a no. You can start reclaiming your time. I also have a podcast launching June 15th, and it's going to be about empowering women to redefine what having it all means. Be delving into balance, time management, entrepreneurship, and life hacks about being a boss on your own terms. So you can check out I'll be posting links, and that's my website right there. So there you go. Those are my 3 secrets to time management. I hope those were helpful for everyone.
You know what? I love how you put this together. And I'm going to tell this audience, both live and all summer long, this is available to listen to, that after I took your time assessment where you had are you a shiny object or you're a procrastinator?
Yeah.
And I identified as a shiny object person.
Oh, yes.
Yes, the awareness of, because I'm a creative, I may be an academic surgeon, but my baseline brain is a creative. I create things, I make things, I make curtains, I bake things. Well,
me too.
Yeah, right. And then you're like, oh my gosh, that's so cool. Let me go do that. But once I became aware, through this, just took the time, if you will, to take your quiz and say, oh, that's right. I am not only a procrastinator, I'm a shiny object person. That self-awareness has helped me even this week as I'm putting together this summit and my ideas don't stop. I consciously caught myself saying, no, it's a shiny object. It's not urgent, not today. It doesn't mean it's not an idea that'll stay, but what I would typically have done would be, oh, bright, shiny object. I'm a high capacity person. I'm going to start it in motion. I'm going to call a bunch of people. Let's get this going. And I held back because that's not good time management, right?
Exactly. And here's the thing. It's these creatives. And I think sometimes we might not have thought of ourselves as creatives. We're in these really science, we're both surgeons, we're in these scientific fields, but I have my sewing machine over there. I like to make jewelry. I have a lot of ideas as well. Yeah. And the thing to recognize is not every idea needs to come to fruition. You can have great ideas that you let simmer for a little. Not every pot needs to be on boiling, right? So
that's great. But you know what? And I have to feel okay with, it's such a good idea. Well, it may be, but not today, not maybe ever.
Yes, not today. Or what I will do is, my kids want to write a children's book along with doing the podcast and the book. So we wanted to do a children's book. Like, I cannot do this right now, but I'm going to schedule it for fourth quarter of the year when I know I will have some time. That can be a family project. So even just scheduling is setting it aside. Yes. If you have, a a year plan, if you are the type of person that creates an annual plan, which I think is such a helpful thing to do, and to create a quarterly plan, it just helps, especially, I mean, for everyone, for not just the people that are like us distractionists, but the procrastinators too, just helps you. All right, I'm not saying no completely, but just not now. And let's do that. We'll tackle that maybe in November. That might be a better time. So, for us, it's about finding that time, but setting a clear deadline as well.
Absolutely. And I love that you just said it like that, because it just validates me that, after this summit is done, in the next 2 weeks before June 1 starts, I have a project I have to finish, right? I mean, I do. And I have stopped worrying about it until this is over. And then in July, I know I'm going to do this big project that's going to take time. So that kind of time blockness is actually a valid way to do it, right?
Absolutely. I love time blocking. I love batching my week. I mean, there's all of these things that I think are so essential to be able to just reduce the amount of time that you are spending, like switching between big projects or even between tasks during your day or during your week.
The other thing I wanted just to mention that you said before I let you go is say yes wisely, or maybe we flip it and say no is not a dirty word. I say that to women all the time. No is not a dirty word. Few people die when you tell them no. What I got out of what you've said today, which is so much, is that it's not about the time, it's about the mindset, right?
It really is the mindset. And I have this course, for women physicians about time management. And the whole first section is about the mindset, because it really is about the mindset. And I know some of people to get into the hacks and the productivity, and it's not about the productivity hacks and the calendar and the having how to hire an assistant. It is about the mindset. And I think I love Peloton. I don't know. I'm a big Peloton rider, and I love Robin Arzon. And she has this article where she talks about saying no. You have to practice it. It's a muscle. And you get better and better at it. And no is a complete sentence. That's it. Sometimes you don't. I felt this need just growing up to always explain myself. And you don't necessarily have to do that. You don't have to, well, I can't because of blah, 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 blah. No is fine too.
That's it. Well, thank you so much for coming today to talk about how to make the time of this prime time even more available, right?
Thank you so much for having me, Dr. Wright. It was a lot of fun.
Thank you. And I'll talk to you soon. Wow. That was an amazing day. We started out at 10 o'clock this morning, and we have covered so much amazing tips and hacks and philosophy for making this the best of life, being in passionate pursuit of the best of life. And, today was exactly what Women's Health Conversations was designed to do, bring smart, savvy women to the table so that we can all sit together and share ideas and encourage each other and be the best we can be. So we have one more session left. I want you to continue with us as we follow up this segment on being ageless with a segment on being authentic and indefinable. We're going to have an interview I did with Erica Page, who's an artist who has used the method of creativity for healing, not only herself, but other people now, to rethink what healing means and to use creativity to do that. We're having a talk with one of my longtime colleagues and closest friends, K. Marie, MD, to talk about really what it means to be authentic and indefinable from the standpoint of being professional women, wives, partners. And finally, we're continuing with a discussion with Lynn Banaszak, who's an executive. She's an innovator, to talk about how authenticity is actually your superpower. So I am really excited to continue Women's Health Conversations Best of Life Summit with our next segment on being authentic and indefinable. I hope to see you there.